Welcome to the Neurosurgical Case Room, everyone, and welcome to the Global Neurosurgery Conversations, where we explore how neurosurgery is practiced, taught, and evolved across very different worlds. And today, it is a true privilege to be joined by Professor Robert Spetzler, one of the most influential neurosurgeons of our time, known for his work in cerebrovascular surgery, his leadership at the Neurological Institute, and for shaping generations and generations of neurosurgeons worldwide. Thank you so much, sir, for joining us today. I was really, really looking forward to today's session.
My pleasure to join you.
I am Dr. Kanwal Ali. Just a brief introduction. I'm a neurosurgeon from Pakistan and founder of the Neurosurgical Case Room. It is a global academic platform connecting neurosurgeons across more than 50 countries, many from resource-limited settings. So this series is built around one idea: how neurosurgery evolves across very different systems. And there is no one obviously better to begin that conversation with than you. So I'd like to begin with a fundamental question. If you were starting your career today in a resource limited system, how would you approach your training differently?
Dr. Ali, I think today's ability to connect across, just like we are doing today, across the world, has really opened up neurosurgical education to virtually anybody. And this ability to have courses that are web-based, to visit any sort of meeting via the internet, really allows an educational format that was never conceived possible when I started training. And as a result of that, I have seen pockets of superb neurosurgical centers cropping up in areas that didn't have the kind of resources that were mandatory in a place like the United States. So it has been incredibly gratifying to see these tools have such an impact on the quality of neurosurgery worldwide.
That's a really, really interesting perspective. I think part of the reason that it became a global community sort of was COVID as well. Since COVID happened, I think a neurosurgical community became a lot more active on the internet, and these conversations, these webinars, they became sort of a norm for us. And I'm really glad that we as a community were very open to it in comparison with if I see other specialties of medicine. Neurosurgery is all around, be it webinars, be it online trainings, and there is a certain level of generosity in the community as well. So, yes, I see that the exposure has increased. But as a result of that exposure, I think a certain level of discontentment with their own training and their own infrastructure has also begun sprouting among people who are working in currently middle income countries and lower middle income countries. So, what do you think about that?
Well, I think that's very true. On the other hand, being unhappy or discontented is an incredible motivator to improve. If you look at, for example, what has happened to poverty worldwide, there have been incredible progress. If you consider neurosurgery from where it was 50 years ago to where it is now, even in the impoverished middle income countries, it has made huge strides. So I would like to see discontent be a motivator, not something that is just negative.
Yes, I think I would heartily agree because once somebody gets that discontentment in their life, they would learn to think beyond this concrete walls. They would learn to think beyond what is possible for their own limited systems. And I think for a young neurosurgeon, that is the primary motivator. So, despite differences in systems, what aspects of neurosurgery do you believe are truly universal?
Well, I think when you look at neurosurgery as a whole, and you look at conflicts around the world, trauma in neurosurgery remains an essential, basic need worldwide. Once you get past trauma, then you look at the more common entities that inflict populations. And so you have stroke, which is a big one, and with the advances in endovascular surgery, this is something that can be treated with relatively little technology once you get the basic technology in place. You have things like Parkinson's disease. You can have um, um, things like aneurysms tend to be very infrequent in a population, but certainly we can make a big impact, whether it's with direct surgery, with microsurgery, or with endovascular. So I think there are a lot of basic components of neurosurgery which are applicable everywhere in the world.
Interestingly, this is what my next question was about. Since we see that AI is very, very rapidly infiltrating all the fields we are concerned with, we see how it is being used incredibly in radiology and what it is capable of doing in terms of patient care, in terms of predictions, and radiomics is blowing up. A lot of long distance surgery is now in the conversation. Robotic surgery has made that possible as well. So I do see the trickle down in neurosurgery as well, and it's not as far off as a lot of people would like to think. I would be very interested to hear your perspective on what elements of surgical judgment you think there are that cannot be replaced by technology.
Well, the one thing that can't be replaced by technology is the human side. The fact that there's a patient that would like to have your empathy and your expertise. Um, Technology is impressive. I think when you look at AI, we have been implanting Mr. Musk's devices into the brain, which uses robotics, which uses AI. The fact is, the whole implant, the only role the neurosurgeon plays is really making the hole in the skull, and then the robot takes over and places this array of instruments of electrodes that are so dense that you can really look at individual neurons. And with that, you have a feedback so that you can make um, a person with ALS, for example, who has lost his voice, be able to speak normally because it goes backwards and it takes that particular patient's recording from the past for whatever reasons. And so identifies the cadences of that speech so that when the computer is speaking for that particular patient, it sounds just like the patient. And you can see that all on the internet. And that's really a combination of what AI can produce, robotics can implement, and what the bright minds of human beings can create.
Yeah, that's interesting, and that's a very positive outlook at the AI integration into the medicine. I think as long as AI is still being guided by the human oversight, it's going to stay in the picture. Otherwise, medicine is, I think it's probably going to be one of the last fields that will be completely AI dependent because, yes, the patients do rely on our empathy and the human side. And a sick person would not want to hear a robotic voice or a robotic perspective. So the human side is invaluable there. How do you see the balance between experience and infrastructure in determining the outcomes?
Well, I don't think anything can replace experience, but I think infrastructure can give you a lot of experience from past individuals so that you don't have to repeat the same mistakes that we have made. I think that's one of the incredible positive aspects of education is that today we have courses that you have models that you can practice on. You have the ability to look at videos that have been performed by the experts in their respective subspecialties, and you can learn to be at a much higher start point than the residents of the in the past. So you have a direct benefit to the patient. It may be your first case, but you're already much more knowledgeable than the neurosurgical trainee of 30 years ago.
Yeah, that's a great advantage. But then again, technology does end up becoming a limited factor when it comes to middle income countries and low middle income countries. So eventually, I think even that will end up trickling down. We probably would take some time, more time, but hopefully it will end up, being more economical and it will trickle down back there. But there is a certain drawback for residents who are being trained in highly resourced environments as well, because obviously nobody gets a full plate. How should neurosurgeons ensure that technology supports judgment rather than replacing it? I have seen people relying, there's a certain level of over reliance where there is an abundance of technology as well. What do you think about that?
I think there's truth to that. I think um, I'm very struck by the intelligence of the neurosurgical community, especially our young people and their insights. And really, you are expressing that in a very eloquent manner. By questioning these, I think you automatically put technology in its proper place. Technology is your support. Your job is to know what technology is available to you, and how to use it the best on behalf of your patients. Technology can be very seductive. So that, as an example, if you have a particularly a fancy endovascular uh, capability to treat, say an aneurysm or something, and you don't consider other options, then you are being seduced by technology in a negative way. If you, however, are considering all the options, then it's important to have whatever technology can offer you and implement that in your decision-making process. Does that make sense, the difference between the two to you?
Yeah, it does. It sort of does. Technology is always going to be a tool, and the better the person is who is using the tool, the better the technology is going to be at the end of the day. It's just a tool, but it helps when someone has nice tools.
Yeah,
I don't think you would
very
disagree
true.
with that.
Very true.
Okay, so for neurosurgeons working in resource-limited settings, what do you think they should prioritize in their training above everything else?
Oh, I, um, first of all, I've always stressed to the residents and fellows is you have an obligation to your patients because they entrust their lives in your hands to be the very best you can be. And what is, and that's not restricted to lack of technology. How can you be the best? Well, you can be very, very eager to learn everything that's available to you. And today on the internet, there are so many resources that apply specifically to neurosurgery, where you have masters making presentations, where you can watch videos as to how they accomplish what they do, and you can pattern your own surgical skills based on what you have available and what you are capable of. But I am really struck by the fact that um, this conversation is so reassuring to me at the end of my career as to the incredible desire for our young neurosurgical trainees and young neurosurgeons to further our specialty. And you're doing that just by the conversation.
I think you just made my day by saying this. And yes, this is the primary reason we thought of this series because our platform is usually academically oriented. Because I think there is this need of real conversations where we discuss real problems and the way forward. Because at the end of the day, this is again a technology and it has decreased the distance between us. So it is across the worlds at present, across the time zones, in fact. So, what are some common mistakes? Because I'm a young neurosurgeon, I have cleared my exit exam just 4 months ago, and I am also very interested to know your perspective on this as a person. What are some common mistakes young neurosurgeons make when they are trying to emulate high income systems in their own practices?
That's a very broad question, and I'll give you my thoughts. First, I think a young trainee needs to look in the mirror and decide in an honest manner of what they are comfortable in doing. And that means that if you have a very difficult case, you may want in the beginning to refer that to a more senior colleague and learn from that senior colleague in order to avoid having a disaster. Once a young neurosurgeon has a disaster, it sort of sits on his or her shoulder and it has impact on what patient is going to be referred to you next. The second is to recognize that there is nobody that hasn't made mistakes and has had disasters. The important part of having a complication is to learn from that complication. It is our job that when we have a complication is to analyze it honestly and then come up with some sort of rational changes we would make next time we see a patient with the same problem. So I think it's a continuing process, and I think reflection on what you are doing and learning from it is what's important.
Yeah, I think as a surgeon, the most important tool anyone can have is to recognize their own limitations. And there is no wrong time to ask for help or to ask for opinion from somebody higher up who has seen more cases and who will probably have a slightly more wider portfolio than you. So yes, recognizing the limitations is really, really important, and especially before you step into the OR. Because if you're not recognizing it preoperatively, then you're going to recognize it peroperatively, and that's not going to be nice, neither for you or for the patient. So, in your experience, what do you think would ultimately define excellence in neurosurgery? Is it outcomes? Is it techniques? Or is it something less tangible?
Well, I think it's a combination. I think number one is certainly outcomes. If you have bad outcomes, it doesn't make any difference that you have great technique or a spectacular surgeon. I think the most important part of any neurosurgeon is judgment. And judgment is what includes as to what you can do and what you shouldn't do. And judgment includes that when you are tackling something that is difficult and you have the patient's head open and you're looking through the microscope and you're thinking to yourself, I don't know whether I should do this next step or not. When that comes up, it's best not to do it, to, to close back up, to reassess everything, and then make a decision based on the information that you've gathered.
So, what do you think will matter most for the next generation of neurosurgeons globally? Because you have had a beautiful run, both as a surgeon and as a mentor. So, what is your say on that?
Well, I'm incredibly optimistic on the quality of our young trainees, their commitment, their compassion, and I think the world of neurosurgery remains bright. I the reason I do so many web-based presentations is because I'm a strong believer that communication is essential so that we can spread a degree of excellence into every corner of the world. We have the Barrow Neurological Institute has a program in Tanzania where we have a permanent presence, not just a neurosurgeon going over and operating a few times, which is really only to the benefit of the neurosurgeon, but where we have a permanent presence with neurosurgery, with fellows, and we are training our colleagues in Tanzania. We are teaching them, and naturally, they are teaching us. And this sort of back and forth and this sort of spreading of technological as well as clinical and surgical excellence is, I think, what harbors a great point of optimism for neurosurgery around the world.
Thank you, sir. This is going to be my last question because I'm going to leave a minute or two. People keep leaving their questions in the chat box since these are interactive sessions. So everyone, this is my last question. And afterwards, if anybody wants to ask any questions, they can just unmute themselves and ask it directly. So, sir, when everything else is set aside, the cases, the numbers, the stats, and the achievements, what ultimately remains as a neurosurgeon's legacy?
Well, I can tell you that I've received within the past week a lovely note from a patient who I operated on 28 years ago that has thanked me for what I did. And I had another note from a former resident who said that I had such an impact on not only how he practices neurosurgery, but how he treats his patients, which he claims he learned from me. So those are incredible, rewarding legacies.
That's beautiful. That's really beautiful. And I really hope that by the end of my career run, hopefully, inshallah, I stand at the same point. You have been a huge inspiration for me. I have been following Barrow Neuro throughout my residency. I have seen all the base camp videos, etc. In fact, this series stemmed out after I was watching the latest base camp series. So yes, I owe you that too as well. Everyone else, this is open house now. If you want to ask any question, please keep it brief and don't leave it in chat box. Unmute yourself and ask directly. Dr. Lalita, I saw your message there.
Hello. Hi, I'm Lalita from Malaysia. Hi. Thank you, Dr. Kawal. Hi, Prof. So in terms of, thank you for, taking up this conversation. It's very exciting. So I have a question. So I'm a trainee in my second year currently. So I do have very senior professors and, when they talk about skills of their time and all that. So I'm just wondering, like, in this time and age of technology and advancements, um, is there a role of learning how things were done like back in the day and by learning that, is there like any advantage to current practices or is there anything like you would think of as an outdated skill or something like that? Yeah.
Yeah, I understand that. When I started my career, I was with a neurosurgeon called Dr. Busey, who was at that time was the most prominent neurosurgeon in the United States. And he had the foresight to create a internship which did not include uh, uh, 6 months or 9 months of general surgery. He said the skills you learn there are not applicable. It was the dawn of microsurgery, and I couldn't agree more. You need to know general neurosurgery in the sense of having at your behest the personal tools of being able to open the skull and to be able to manage anything that you encounter in that point. But is it important, for example, to spend a year doing general surgery first? I don't think so. You're much better off spending a month in the ICU or with neurology, etc. So yes, there are things to leave behind, but you still have to have the basic skill set to take care of your problems.
All right.
Thank you,
Thank
Dr.
you, sir.
Lalita.
Yeah.
Do we have any other question? Please keep it brief. None? Okay.
I would
Thank
like
you.
to
Sir.
add.
I would like,
Okay,
thank you,
yes,
Dr.
Dr. Bogani.
Spetzler.
Yes.
Dr. Ayman. Okay, yes, Dr. Ayman.
Okay. I would like to thank you, Dr. Spetzler, about this great opportunity, and Dr. Kanwal, and thanks a lot. Uh, my questions to you, Dr. Spetzler, as a training, I mean, in the low-income countries and the low case volume countries, what are your recommendations? I mean, to the junior resident that
Yeah.
increase their training value, or to, because we don't have a lot of cases, how we can increase our training benefit or training quality.
Yeah, I see your chat, and I think it's a problem, and it depends how much you drive to get really the ability to go elsewhere, to watch something, to get involved elsewhere. We've had at the BNI, we have had hundreds and hundreds of foreign fellows who come for an observership just to watch. We've had those that join the lab and spend a lot of time in the lab, as well as watching clinical and attend rounds. As I mentioned already, you have so much information that's available to you directly through the internet. On YouTube, you have endless presentations to follow, but nothing really replaces getting your hands on and seeing if there aren't any courses that are within reach, both distance-wise and economically, to enhance your skills. I think just really striving to be the best you can be, opens up a lot of doors.
Thanks a lot.
I
Highly
see.
appreciate it.
I see Dr. Tawassul has raised his hand. Dr. Tawassul, do you have a question?
Hello. Good evening, Professor. Good evening, everyone.
Good evening.
It is a great pleasure to meet you, Professor. Just I have one question. As a growing neurosurgeon in a low and middle income countries, how can I balance between doing researches and operations and clinical care for the patient, and how can I get involved in a global research work?
Yeah.
I started to learn about how to do meta-analysis because it is just feasible at the beginning, but how can I increase my perspective and my research perspective during my career?
Yeah.
So I can balance between both of them.
Yeah, it's not easy, but you've already started off by taking on something that's within reach. Meta-analysis really provides somebody to look at a large number of publications and making sense out of them, and that's available to anybody that has the ability to go on the web. So I like that. Now, to extend that is to get involved in organizations like the WFNS, the World Federation of Neurosurgical Societies. They have all sorts of programs for young neurosurgeons, and it's a good way to get into contact with potential mentors. And, there's nothing wrong with sending endless emails to places that you hold in high respect and saying, is there something I could do to get involved with your research or with your training or a visit, etc. I think it's that sort of pursuit that will often be very frustrating, but in the end result in an opportunity that you hadn't anticipated.
Thank you. Thank
So
you.
we are going to take our last question since sir is also running out of time. Dr. Bugani, please keep it brief. I see you have raised your hand. Please keep it brief.
Yeah, thank you, sir, for the amazing session. I'm a final year resident from the India. So I wanted to know your opinion about like growing the need of subspecialty in neurosurgery. So once I go out, like versus practicing in general neurosurgery or going into need of subspecialty. So when to choose it and what is a necessity? Like, is it necessary in today's time?
Yeah, that's a very good question, Dr. Bogani. It is an incredible specialty that has so many subspecialties. I mean, whether you want to do radiosurgery, whether you want to do functional neurosurgery, which is so exciting right now, whether you want to do microneurosurgery, whether you want to do complex spine surgery. I think you have to look around whether you have a mentor that can sort of accelerate your interest in that, or get the opportunity to do a fellowship where in a location where the specialty that or subspecialty that you are interested in actually exists. But the beauty of neurosurgery is its incredible array of available subspecialties.
Thank you, sir.
Professor Spetzler, thank you so much for a truly insightful and a beautiful conversation. I think what stands out at the end is that while systems and resources may differ, the core of neurosurgery, the judgment, the discipline, and the responsibility, it remains constant across the worlds. So different systems, same responsibility. Thank you so much for being here with us today. And thank you everyone for joining us. This is a wrap.
Bye-bye.
Bye bye, sir.